board-certified nutritionist, Jim Lavelle, with us this evening, as well as Dr. Andrew Heyman, Metabolic Code's Chief Medical Officer. They will present the Metabolic Code Assessment Tool, Air Support. Between them, they have decades of experience in wellness prevention and disease state management. I'm Libby Bricker, System Engagement Liaison with Metabolic Code, and I'll be your moderator this evening. I'll very briefly present the Lifestyle Tool Lifestyle Guidance Portal near the end of the presentation, and we'll definitely break for questions, so please raise your hand or enter a question in the chat box. We also encourage you to stay to the end of the presentation to hear our special offer to try one or both of these Metabolic Code System tools. So Jim and Dr. Heyman, I will let you take it away.
Great, thanks, Libby. Do I have the screen, or do you have the screen?
I have the screen, and I can move
slides. I'll just ask you what. Yeah, I'll just tell you when to forward it, or Andy will ask you when. I'll tell you when to forward it. Anyway, it's a pleasure for everybody for us to be here. I mean, honestly, we were pretty excited about being in Hollywood last weekend and really talking about systems biology as it applies to how you help unwind difficult and complex cases. But not just that; it's how easy it can be to be able to explain things to people. And really, Andy and I developed and worked on this metabolic code system in order to really be a tool that you can use that can simplify that journey towards personalized health that a lot of your patients are attempting to do. There's a lot of misinformation out there. It gets confusing, and you got to give them a focused and guided path. So let's take a look at it. And actually, I'm going to have Dr. Heyman. I'm going to have you do the majority of it. Let me get to this introductory slide, and then we'll take it over. I mean, the beauty of this is that basically when you think of the metabolic code, and I know Andy will address this, but what's interesting is it provides this ability to take a comprehensive survey and then blood data, urine data, saliva data, as well as biometrics, so things like obviously blood pressure, BMI, heart rate, and actually salivary pH or urinary pH, and then begin to actually look at how all of these pieces of information fit together to focus where the prioritization needs to begin for someone. This has been the biggest challenge, is that people get 100 points of reference from a lab test, and they don't know where to begin. And what's even more confusing is the patient, when they leave the office, they can't remember the majority of what you've explained to them. So the beauty of the system is that it takes as much information as you can gather, and it renders a personalized approach and shows where the break in their metabolism is most prevalent. And the other piece to it is that it simplifies that explanation. I like to call it, I'm not as sophisticated, so I like to call it Garanimals Meet Systems Biology, because it's all color-coded. It allows that patient to identify that, oh, I'm in the brown triad or I'm in the blue triad, and the products that are being recommended for me are working on that area of my body. And I think it's important that we don't lose sight that the best plan is it's simplified and easy for the patient to understand it, and it really increases their chances for adherence and allows them to be successful. Because if you're targeting the biggest areas of disruption, most likely you're going to get a win with them, and they're going to feel better at after that first visit, and that's all the meaning in the world for them. If they can feel a little bit better, get a few wins on a couple of their areas, that really creates a positive shift for them, and it gets them engaged in working with you. So I'm going to go ahead, Andy, I'm going to turn this over to you, and I'll just add a few comments here and there wherever I think it's relevant.
Okay, great. Thanks, Jim. Next slide. All right, so, as Jim mentioned, the whole point of this system, the assessment tool, is to take a lot of information and begin to both interpret it and also produce it in a way that both the practitioner and the patient can understand. And so for some of you, you've probably already seen the way that we organize that information, and it's in this model of triads. This was a concept, essentially, a rubric that really Jim came up with many years ago. And it's based on this notion that we have these 5 domains or areas of our metabolism that are unique. They have a relationship within themselves. And in each of these triads or domains, there are 3 elements or body systems that interrelate or are connected. And they have a special relationship. Basically, as one part becomes imbalanced or strained, the other 2 also become influenced as well. And so this forms a domain. The first triad has to do with adrenal, thyroid, pancreas, really the hormones, cortisol, thyroid, and insulin. And I think all of you understand intuitively now that those 3 hormones really move together in specific ways. And it begins to make sense that we would group those 3 hormones into one single subunit. And we have 5 subunits. You can see in this part of the report, triad 3 with cardiopulmonary neurovascular, triad 2, gut, immune, brain, triad 4, liver, lymph, kidney, and triad 5, testosterone, estrogen, progesterone. Each of these areas I know we deal with clinically, and we try to do our best with respect to understanding what might be going on with the cardiovascular system or the digestive tract or the immune system. But again, we're grouping these subunits together in a way where we know these strong interrelationships occur. And this goes beyond just conceptual because of the way that the algorithms that sit behind the system operate. And that is to say, there are thousands and thousands of decision trees and algorithms that are activated when data is inputted into the system. And it begins to look at the set of relationships that occur within each triad. And the output then is really based on these decision metrics, and it organizes the patient's information in a weighted system. And so what we're looking at right now is the overall report with respect to each of the triads. And so this part of the metabolic code assessment gives us essentially the sum total of both the quantitative data that's inputted into the system as well as the qualitative, meaning the surveys. And every data point, qualitative or quantitative, is weighted to one degree or another and organized so that it has relevance to its respective triad and even across triads as well. And so what you're getting then is not just a direct output, but a nuanced, influenced, really thoughtful output with respect to where is my patient struggling the most with their health. And so this particular part of the report is the sum total. It's the summary of all of that information. And what it's doing is it's ranking which of the triads is the most imbalanced. And this begins to get at this notion of where do I start? And the report itself says, in this case, triad 1. And if you look in the left-hand upper portion of the triad box, so for example, in triad 1, it says 675. And that's the total score related to an imbalance. And the higher the number, the worse that triad is functioning. So it immediately gives you a visual cue, a numerical cue to say, triad 1, stress, metabolism, and sugar is really having an issue. And we know that if these numbers are above 500, they're significantly imbalanced. And so for this particular individual, it's triad 1 and triad 3. So not only are they having troubles with stress and their blood sugar and their thyroid, but they're also impacting their cardiovascular system, their cardiopulmonary unit, as well as how that integrates with the autonomic nervous system and the central nervous system to some degree as well. So that's how you would read this portion of the assessment. Now, the whole assessment is 45 pages, and it becomes more and more detailed as we go through it. So why don't we go to the next slide. And we get down to the output. And the output is further back in the report, and the report contains a lot of detail for the provider and the patient. So not only do we give a breakdown with respect to the specific weighting of the questionnaire, but also all of the lab values that are inputted, so that if you have a patient that really wants to see in great minutia, how did we come up with that sort of sum total analysis, the report has that. But once you get through all of it, you really want to see the product recommendations, because this is the output. This is the suggestion that comes from the system itself that says, okay, here are the areas that are imbalanced, and these are the dietary supplements that we would recommend to correct those imbalances. And you could see for this particular patient, the list is not insubstantial. You know, we're talking 10, even 15 particular products, and you can see also how they're color-coded depending on the triad. So that immediately there's a queuing that occurs with respect to which triad or imbalance does this particular suggestion or dietary supplement address. And you can also see, for example, with magnesium glycinate, as many of us know, magnesium is important for so many different bodily processes. It makes sense that all 5 triads would be influenced by magnesium. But as a provider, and in discussion and collaboration with your patient, you might say, look, this is too much. I can't do all of this. So you probably just want to select products that directly map to triad 1 and triad 3, because those were the ones that were the most imbalanced. And a patient might even say that's too much, so you might even just want to focus on triad 1 first. Correct that imbalance, move to triad 3, focus on that one next in the therapeutic process, and so on and so forth. And what you want to do is restore harmony back into the metabolism. And the report gives you the guide and also the suggestions. Now, you can, of course, say, I only want to do a portion of what's suggested or what have you, but that's up to you as the provider. So next slide.
Yeah, and then, we can, and Andy, we can have Libby pull up a complete report too, so that you can just quickly kind of show them what every section has in it without, you know, too much detail. But maybe
Sure.
It might not be a bad idea. So Libby, when you're done, maybe pull one out.
Sure. So after the supplements, there's even more information for the patient. And what will happen is the algorithms within the system recognize which 2 triads are the most imbalanced. And then we have this sort of beautiful graphical representation of that particular triad in addition to a written description of the elements of that triad. So the patient can read about, hey, I'm a triad 1 imbalance, it's adrenal, thyroid, pancreas. What are my adrenal glands? Where are they? What do they do? And then we have this sort of nice prose that they can read to better understand, okay, these are the 2 domains or areas that are affected, and this is what they're responsible for in terms of my health. So there's layers and layers of information that's outputted for the patient.
Yeah, so Libby, why don't we flip over and just quickly show a complete report so that Andy can just highlight all the different areas of the report.
So as I said before, the report is about 45 pages. And so on the one hand, that can sound overwhelming. But as we've seen before, we have one summary page that pulls all the data together in terms of where the imbalances are, and that you can quickly reference it and say, yep, this is a triad 1, triad 3 patient, and that's where we're going to need to begin. And for some patients, that's enough. So this is a sample report. You can see, again, we're at a summary page. And this particular individual, they're a triad 1, triad 2 imbalance in terms of the most deranged. And you can see that the triad 1 is a 920. That's pretty significant. This is a person who's under a tremendous amount of metabolic stress within their triad 1, their adrenal, thyroid, pancreas. But they're also ticking away on gut, immune, brain. Again, both numbers above 500, but even the reproductive hormones, triad 5, are not insignificant at 425. So in some ways, this is an individual who's really an extremist, that they're sort of pulling apart their metabolism across, 3 major domains, if not more. But you can see how it's so easy to just quickly glance at the summary page and say, I get it. This is the output, sum total, of the 5 triads in their imbalance. So if you want to scroll down a little bit more. To the next page. So we can see as we get into the next page, we then begin to show not across the triad concept, but within sort of a diagnostic or predictive lenses. How sick is this individual? How much risk have they accumulated within their metabolism? And so this is another quick way of saying, okay, they're inflamed, they're generating cardiometabolic risk, they probably have low energy, they have a blood sugar problem, they have immune dysfunction, so on and so forth. So that's another kind of metric as a sum total output, because obviously, we like to look at the data through, various lenses. And then we get into the portion of the report that some practitioners and patients will absolutely dive into because they love the details. And this is just showing you exactly how we got to the sum total for Triad 1. And this section has to do with the quantitative results, the lab values. And you can see how this person's cortisol levels are very abnormal. And so they're clearly experiencing a significant amount of perceived stress, and the body is interpreting that in a very negative way. And as we keep scrolling down, you'll see why this person was a 920. They have a lot of metabolic risk. And also, they were in the 600s for gut immune brain. And here we have the markers for Triad 3, cardiovascular, pulmonary, cardiopulmonary neurovascular. And so we begin to rank out their cholesterol, their inflammatory markers, their biometrics, including their blood pressure and pulse. All of this is included in the system. So you can see in great detail how we've begun to organize the data. Triad 4, liver, lymph, kidney, and you can keep scrolling. And we can get to the symptom section now. So that was the lab section. And of course, we'll do the same thing for the symptom scale, and we can show what are the numbers relevant to just the questionnaire that the patient completed. And of course, symptoms and the patient's illness experience is just as important as the lab values. And so the weighting draws together both of those areas of the report to create the sum total. But here we've broken out the results of the survey, and you can see it's actually in a sense in the same order that their total summary laid out, which was Triad 1, Triad 2, and Triad 5 in that way as well. So there's real symmetry between how the patient feels and their biological reality. So you can keep scrolling. And then we go down a layer once again. So we've aligned labs and symptoms within a triad, but of course there are metabolic levers and influencers that might sort of primarily locate within one physiologic domain, but has real import across other domains. So for example, in this particular patient, we know that homocysteine, which would, of course, would sort of live in Triad 3 in terms of cardiopulmonary neurovascular, is really important as a marker for B vitamin status, which has to do with stress. It has to even do with blood sugar control. And if it's elevated, we want to have a weighting system to give some import into Triad 1. So we have a Triad 3, Triad 1 relationship here just on the homocysteine. And you can see we're doing that with some of the other markers as well, because we have to kind of give reference to how one area of metabolism is affected by all the other areas. And so this gives a graphical and structural representation of what are those additional influencers. This is, again, another layer deeper to show sort of the interactive effects between a set of metabolic markers and a particular triad. So you can keep scrolling. And then we go another layer deeper. So for your patients that really love to be in the weeds, they love the minutia, and they might say, that's great, Dr. Heyman. I got my report. I see my Triad 1 is imbalanced. I see that my DHEA is in the yellow zone next to the triangle. in the lab report section, but what's DHEA? What does that mean? So every lab that is in the yellow or red zone will be called out in this part of the report, and the patient can read about that particular analyte or marker in detail. What is it? Where is it produced? What are the illnesses that are associated with it? So we go into even greater detail around what all of this means. And again, look, not every patient is going to want to go to this level of detail. We get that and we understand it. But it's there as a reference. And, you know, as Jim pointed out, patients really forget almost all of what we talk about in clinic, up to 80% or more. You know, so they need a reference tool, right? They need to be able to go home and reflect on what we talked about. They want to read about it a little bit more. And so we have a snapshot in greater and greater and greater detail around where is their health and metabolism today.
Yeah, and I'll just add one thing to that, Andy. It's that, you know, when you and I were putting this together, we thought, man, maybe this is a little too much overkill. But I have to say that the majority of the people that I hand this report to, they absolutely love all the reference material because they actually come back and ask smarter questions about the next step in treatment instead of just kind of like coming back in still not understanding what the heck happened to them from the last visit. So it really, it's been interesting to watch people read the report and then come in and then be more engaged about the information they learned about themselves.
Right. And if you think about it, if you really think about it, this section of the report is essentially what we do to patients normally. We get a bunch of labs, which are a bunch of numbers, and then they're sort of ranked, you know, normal or abnormal. And they look at that and there's no context. It's just a list of labs. And it's your job to try and explain and organize all of that information and give import to it. And one of the beauties of the assessment tool is that we start with context. We start with the overall picture of, let's get to the bottom line. This is where you're imbalanced. Adrenal, thyroid, pancreas, stress, metabolism, sugar. And then you go into the details. So you explain first, and then you talk about the data. And we do it completely opposite in medicine. We sort of just, you know, essentially hand a bunch of labs to a patient and hope for the best. And they have to somehow organize it in their mind. And it's not fair, quite frankly, because you're subject to just how the lab, you know, reports the outputs in order. You know, here's a CBC, here's a TSH, here's homocysteine, here's a vitamin D. You know, sometimes labs are near each other on the same page that are related, but most times they're not. So we're sort of, you know, taking all that and putting it together in a way where not only is it easy for you to understand as a practitioner, but it's also really easy for the patient. And we've created a kind of language and framework around that discussion so you're on the same page. You say triad one, they say triad one, and they get it. And this has been a really powerful model for us in that regard. So we can keep scrolling down. Here's a saliva cortisol pattern. This is what we saw reflected in the quantitative output under adrenals as well. And then there are additional databases that are built into the system. You know, the algorithms are so sophisticated that they're not just assessing, you know, the labs themselves, but also the medications that the patient is on. And because of all of the work over the many, many years that Jim has done, beginning back at University of Cincinnati on drug-induced nutrient depletions, you need that database in here because that's part of the strain and stress on a patient's metabolism. And that then becomes part of the output too, sort of, you know, giving a import to the fact that obviously, you know, as we've talked about, you know, in many, many lectures, the ways in which drugs drain the body of nutrients. And so this is you know, that section of the report that shows where the potential depletions are based on their medication list, and then the recommendations of repleting nutrients appear in the supplement section. And then we're back to where we were, which is the output. Once again, a list of dietary supplements that we feel would best regulate the imbalances that are detected within each triad. And of course, supplements can work across triads, and that's referenced to here based on the number of triangles that are placed next to the particular dietary supplement. So it's really easy to follow. And it's not something that, again, you have to choose everything. Yeah.
That's right. And the one thing is, guys, at the beginning presentation, it wasn't ranked. This is a more current report. And it ranks color-coded all the way through the top 5 triads, so you can pick which things you want to give, but it ranks it from the top to the bottom. So you'll see all the brown are top, then the blue, and then it goes down from there. So, you know, it makes it easy for you to kind of go, hey, I really want to work here, but gee, in addition to that, I want to burn some estrogen off too, or I want to work on bone, or no, gee, I know I don't really need, you know, I just like aged garlic, I'm going to give it to them. But you're the one in control of dictating what you want to give people. It just helps organize, you know, what nutrients. And then the other thing is that with our new delivery system with Nutralogic, which we just announced the acquisition of, we're able to supply, like, say you're an ortho person, or you're a DFH person, or you're a meta person, or we've got, you know, if you don't like that brand, it will let you select which brand you want, and it will set up an auto ship account so that you can actually auto ship right to the patient if you want, or you can choose to, you know, obviously continue the relationship and stock in-house, but the auto ship program works really well. I thought I'd just add that in because it's really just an announcement we made just last weekend.
Great.
Well, thank you both.
Yeah.
Any last words on air support, Andy? I was just going to briefly touch on LGP and go to any questions.
Well, I was going to hand it off to you and say, you know, we understand that, you know, framing where a patient is at in terms of their metabolism and recommending supplements is great, but that's a, you know, only part of the story. And that, you know, we also have to have tools in place to affect healthy behavior change, and that's how a patient moves and breathes and eats and sleeps, and we need to be able to track them over time. And so, you know, Libby's going to flip over to the second part of the system, which is our lifestyle guidance portal.
Yes, great. So as we mentioned in the beginning, the metabolic code system is 2 tools, the assessment tool and the lifestyle tool. The lifestyle guidance portal does allow you to keep in touch with the patient in between visits and provide them very detailed material on how to adhere to lifestyle changes with both diet and exercise. So you have a huge library of wellness plans and the lifestyle guidance portal that you have access to. You assign what is appropriate for that patient, and then the material is automated and will send to the patient on a daily basis via email or their mobile device, so that you have about 60 wellness plans in the library, as well as a very large monograph library, which provides monographs on both conditions and supplements that you can use for your reference and to share for further education with patients. You can share those electronically or print from the library itself, which is what we're covering on this slide here, the ongoing education and support that we provide to you if you subscribe to the Metabolic Code system. We'll have ongoing webinars, access to the monograph library, product information, and the privately branded lifestyle portal, which I have an example pulled up for that. We can brand the wellness portal with your practice information, and where you sign up for the Metabolic Code trial is on metaboliccode.com. The Join Now box in the upper right-hand corner will bring you to this screen where you have the option to trial one or both parts of the metabolic code system. So you can click on either one of these, and the rate is $348 a month after the free trial, so 30 days free, and then $348 a month for both components. So if you just have a need for one or the other, the prices are broken down up here. $199 a month for the assessment tool, air support, or $249 a month for the lifestyle tool, lifestyle guidance portal, and that is unlimited patient enrollment and patient use. We do also support you in training staff on how to use the program, and that's ongoing. So if you have any turnover, you don't have to worry about the burden of retraining anyone. That's always something that we will facilitate for you and make sure that you have all the help that you need in implementing these tools. So Lindsay, if you could let us know if any questions have come through so we can address those. I know we've gone a little bit over time here by a couple minutes.
Okay, I do have a question. I like the recommendations, but I have my own product line. Can that work?
Yes, that definitely works. You will always have the final say on how you put together your protocol and use the report recommendations as a guide. You will receive the margin of return if you do utilize our online store. So it's an easy way to recoup your subscription money if you'd like to utilize those products. And if you would like to continue using your own lines, that's certainly fine too.
Libby, I don't see any further questions at this time.
Okay, Lindsay, well, thank you so much, and thank you everyone for being here. We really appreciate you coming to join us this evening and learn about the metabolic code system. We look forward to working with you soon and hope that you'll visit metaboliccode.com to trial one or both tools. So thank you so much.
Thanks, everyone. Have a good evening.
Thank you. Thank you.